Good evening, everyone. I'm Colonel Jeremy Bell, the Garrison Commander for Fort Campbell. And thanks for tuning in this evening to the Facebook Town Hall. Again, we're going to talk about the coronavirus. I think our theme tonight is going to be about responsible decision making as a community. But we also listened to some of your input over the last week, and we teed up a couple topics that we think will be of interest to you. Good order and discipline, masks seem to be on everyone's minds, the quarantine and isolation facilities on the installation, and resiliency. But before I kind of kick off the town hall itself, I think what I'd like to do is just give you an example of what this virus can do to an organization, kind of its impact. So just a few weeks ago, the New York City Police Department had much fewer than 100 cases of coronavirus positive officers on their workforce. Today they stand at over 2,000 infected, and 20% of their population is calling out sick because of sickness. And that's devastating to an organization. But just like New York City is the first or the police department is the first responders for New York City, so too is the Army the first responder for our nation. So I think it's illustrative to point out the impact of the virus on the police department in New York. Because it's mission critical that we protect our soldiers in this time of crisis. The way we can do that is all the things that we've told you about over the last several weeks: the social distancing, the hygiene, the increased cleanliness, and staying at home. But really, it's about making good personal decisions that protect you, that protect our soldier. And ultimately, it's our job as a community to protect our soldiers so that when called upon, they can protect our nation. The other piece I'll highlight before moving on is we have to hold each other accountable as a community. We're stronger when we share information, when we come together and work towards one common goal. And this is a crisis where I think we've done a great job of that so far, and hopefully we can continue doing that. Just to put it in perspective, we are about 2 to 3 weeks behind the nation in this coronavirus, and the nation is probably going to hit its worst week of coronavirus so far. So I ask that everyone remain focused, that you make good decisions as individuals and as a community. So with that, sir, I'll hand it over to you for introductory remarks.
Sure, thanks. Well, good evening, everyone. Again, my name's Major General Brian Winsky, Commander of the 101st Airborne Division Air Assault in Fort Campbell. Command Sergeant Major Barker is with us tonight, and he and I remain committed, as we have been throughout all of this, to keeping you informed and sharing with you and ensuring that you know what we know with regard to the general situation, and then share with you any initiatives that we make. And as a reminder, we have an incredible team helping us make these decisions. Our division surgeon, the hospital commander, our emergency services director, our infectious disease physicians, etc., are all part of the decision process on every single major significant decision that we do make. So as we said in last week's town hall, DOD's implemented some guidance that we're not going to convey exact numbers of how many cases we have, but we do have positive cases on Fort Campbell, and I'll just share with you in general terms the general situation there. First of all, we're on a much lower trajectory than the surrounding counties, the cities around us, and certainly major metro areas like Nashville, and you'd expect that. The great news is none of the individuals that we have that were confirmed positive required hospitalization. In general terms, especially for the service members, and when I talk the total numbers, I'm talking service members, their family members, retirees, retiree family members, our contractors that are part of our civilian workforce, and of course our Department of the Army and Department of Defense civilian workforce. For the most part, for those positives that we're tracking now that are still active cases, they felt the effects of COVID about a week and a half ago. They reported to their chain of command, got checked out medically, got tested, and then during the time that they were waiting for their tests, we put them in quarantine. We continued checking up on them. We had medical care available to ensure that they're not taking a downturn in any way. And then even before the test results came back in 4 or 5 days, their body fought the disease off, and they were kind of coming out of it like you'd come out of any type of sickness. That was the majority of the cases are that type of scenario. And again, even those that are still feeling the effects of it that are active cases do not require hospitalization. We have them in isolation, either at their home or in the isolation facility that we have that's staffed by medical professionals here. So again, the good news is we have some cases, but they're all doing really, really well. And I will share some general numbers so you have a sense of it. Less than a dozen of the active cases that we have are service members, active duty service members. A like number are family members, retirees, family members, DOD civilians, or contractors, as I said. And in accordance with the guidance on reporting, we're not going to give you the exact number, and it changes a little bit each day. But just for a sense of perspective, considering the population of Fort Campbell, we're talking 0.04 of 1% are active positive cases. And again, of all those positive cases, they're all doing great and don't require hospitalization. And we've had a number that have already been medically cleared and released. Their body fought it off, they're fundamentally immune to it now, and they're returned to duty. So that tells us that a few things that we've implemented as a team across Fort Campbell here over the last few weeks is working. The social distancing, keeping it to essential manning, all of those efforts paid off, and we're going to keep those in implementation through at least the month of April, and we're assessing on almost a daily basis and formally weekly determine how much further we'll push that beyond the month of April. But at least for the next few weeks, we're going to have the same fundamental implementation of distancing and small groups, no formations, etc., and the essential manning. Right outside our gates across Tennessee, Governor Lee issued a stay-at-home order allowing travel outside of the home for essential activities, and that really includes for DOD transit from if you live off post to on post, and other fundamental things like getting sustenance, groceries, food, etc. That follows a similar order in Kentucky. So the two states that we straddle are essentially under a stay-at-home order, similar to our HPCon Charlie, with some additional measures that we've implemented. And again, we're going to stay in line with that. To give you a perspective of the number of cases in the surrounding communities, so for Tennessee, where most of our folks live, there's been about 4,068 cases as of midday today. In Montgomery County, which includes Clarksville and out to exit 811, 54 positive cases. In Kentucky, far fewer, and they're a bit further away than where you'd expect. Most of Tennessee's are in Nashville. Most of Kentucky's are in Louisville, up in the northern part of the state, Louisville and Lexington. They have 1,245, and in Christian County, which includes Hopkinsville and Oak Grove, 32 cases. Back to our cases, they're mainly travel related. Again, it tells us that this thing spreads and you can carry it back even if you're not symptomatic. And again, a lot of the things that we've implemented, the 50-mile radius that you cannot go beyond, the very limited approvals for emergency leave and those sorts of things, which now will include a quarantine period when those individuals return, the stay-at-home directives, the social distancing, all those things, and our fundamental discipline and the way we're approaching this is working. We have a number of deployments in support of this, and last week, or the town hall before that, we knew that the 531st Hospital Center was going to be deployed, and they, again, continue to make us proud. Everything that you see about New York and the Javits Center and that incredible facility made there, that was all at the hands of the 531st, another hospital unit from Fort Hood, Texas is there with them, and then some New York Guard, and of course the hospital ship there with the Navy backstopping them. They, again, are going to continue to save lives for our fellow citizens in New York, and couldn't be prouder of the 531st and remain committed to taking care of their families in their absence. 3rd Brigade continues with the Southwest Border Mission, a critical mission that we bolstered with another 275 or so soldiers over the course of the early part of this week. Again, a relatively short notice, and they deployed quickly to bolster the effort to secure the southern border of our nation. There's been no cases with our 3rd Brigade troopers forward on the Southwest Border Mission as well. And then 3rd Brigade also has a task force in Africa. Again, no issues or reported cases with any of our soldiers there, serving as the response force and security elements in Africa, doing an incredibly important mission there. And then our Sustainment Brigade, the Lifeliners, have multiple missions with fairly small units all across CENTCOM and a number of locations, and they are likely going to be called on to support the efforts up in New York, and then as this virus moves across the country, they're likely going to be called to support major DOD efforts to help with this. The heart of what DOD brings to the fight against COVID is our medical capability, of course, But like everything, if it's not sustained, if it doesn't have the right logistics to it, it's a short-term proposition. So we're going to backstop the 531st with elements from the Lifeliners, and then wherever, again, DOD arrays capability in this fight, the sustainment brigade's likely going to be called to help with that. More to follow. Mission essential activities. So we have a number of things that are underway on a day-to-day basis that are essential activities, largely in the maintenance arena. Command Sergeant Major Barker and I visited a hangar today. Some great soldiers working on our aircraft, ensuring that the cab is going to be ready for the deployment to Korea in June, and later in June and early July to Afghanistan and across Europe. And we also have a lot of ground maintenance going on with our vehicle fleets in preparation for that deployment with the cab, as well as just fundamental readiness and sustaining readiness and ensuring we're prepared when this thing's behind us to resume training, which is our ultimate responsibility to ensure every soldier in the 101st and at Fort Campbell is trained and ready for combat. And though we have a little bit of a lull in training right now, it has not had a major degradation in our overall readiness because we've been focusing these essential activities on maintenance, on some training, on physical training, and when this thing is behind us, we can snap into larger scale collective training to include our JROTC, Joint Readiness Training Center rotations at the end of the summer in August and September. So again, I wanted to share with you what we know. Again, we have some cases. They're getting phenomenal medical care. None require hospitalization. They are going to pull out of it. Absolutely confident in that, both the service members and the non-service member cases that we have. And what we're doing is working, so keep that up and look forward to your questions. Command Sergeant Major Barker.
Sir, thank you. There's a lot of changes that came out this past week. One of the big ones that is on everybody's mind is the Secretary of Defense and the new mask memo that was put out on April 5th. So some guidelines have come out to help clarify some of that guidance. Now these face masks are not designed, the N95 series masks that our healthcare professionals need that are in shortage across the nation. These masks are a measure that's put in place for us to protect others from potentially contracting the coronavirus. And so it can be a cloth, it can be one of the face shields that you'd see for like sanding, or a dust mask type thing that would be tan, blue, or some of the colors you'll see them in. And some folks I've seen going around the installation day have already procured those or had them on hand before. There's also, you can use a cloth item or a bandana, scarf, cravat, those types of field expedient things. I've seen some folks as creative as well, using shop towels or tech wipes or whatnot with rubber bands. So people are figuring out how to do this. But what's important is it covers your nose, your mouth, and goes up the sides of your face and covers your chin as well to prevent any spit or anything from going onto a surface or another person and potentially spreading the disease. And what we found too, as we've gone through this, a lot of healthy people are asymptomatic, meaning they won't have the signs and symptoms of having the virus. And so there could be somebody potentially that is carrying the virus that's out there, doesn't feel sick, feels fine, and is potentially spreading it unknowingly. And so this is a measure that we've put in place to prevent that from potentially happening. So with the cloth, obviously make sure it's earth tone type colors, black, brown, green, tan, those types of colors. We're not looking for people out there with, this isn't an opportunity to express yourself. We don't need the pinks or the bright oranges or things like that, or no print on there, no wording, obviously no profanity. This is a protective measure that we're putting in place, and that's the whole reason behind it. There's also been a lot of discussion about extensions and re-enlistments, and each one of these cases is ultimately up to that soldier's commander. What a lot of soldiers are seeing is it's with the economy over the last month, about 750,000 jobs lost in the month of March. Things are a little bit scary out there. And it should also show you that being in the Army is a pretty secure profession, and we'll always have work. So I encourage folks that are considering an extension. It's going to be balanced with the needs of the unit, not just with the needs of the individual. So if you're contemplating re-enlisting or not ready to get out of the Army, your career counselors are available, your chain of command is available. and the Army's open for business. Sir, that's all I have for opening comments this evening.
Yeah, so I'll just clarify something before I hand it over to Patrick Birchfield for opening remarks. So on the masks, only to be used if if you can't abide by the social distancing, and that's the 6-foot separation, and if you're in an enclosed space for a long period of time with individuals.
Yeah, I'd call it encouraged all the time,
Absolutely.
required when you can't maintain that social distancing. Like we saw with mechanics today, where they're grappling with a major component of a Humvee that they're working on and stuff. They're in such close proximity, they really got to have that mask.
Perfect. Okay. So over to you, Patrick, for any opening remarks.
Hey, thanks a lot. Again, in the interest of social distancing, I'm a little bit further away from the rest of the group, the reporter at the remote location. So last week when I started off, I thanked everybody at Bach for all the tireless work they put in to making this COVID effort that we've gone through a success. And they've done the community very, very proud. Today I want to start off with thanking the community. The community's done everything that we've asked of them so far. They've done the social distancing, and we can tell the testing that we've done based on the symptoms is exactly what we want it to be. So thanks to the community, and keep doing the proper social distancing measures. Based on our feedback from previous town halls, we looked at some of the questions that folks had, and I want to address a couple things. First thing I want to start off with is the vaccinations for kids that are vaccination for kids in general. And what we've come to the conclusion is that we're going to go ahead and continue those for kids that are 6 months and younger. And here's why we thought this way. Okay, so this whole thing is about minimizing risk to include the immunization itself. And what we've done is we've decided that those kids that are 6 months and younger, those are the target population that we want to get immunized. And the way that we've mitigated that risk is we've getting them at Bird Clinic. Over on the left side, there's a door on the left side just after the facility's been freshly cleaned. It's at the lowest risk time possible. We get those well babies seen, we get them their immunizations, and then we get them out. Now, we don't have any sick people going through that area, but again, we're trying to mitigate the risk in any way that we can. For kids that are a little bit older than 6 months, we think that they can wait to get their immunizations. After all, immunization is trying to prevent a disease, and if we're doing the proper social distancing, that will have the same effect on the same childhood illnesses that we're trying to prevent with the vaccination. So, of course, this is a temporary measure in this dynamic time of COVID. And if you have a special case, please go ahead and call your provider, and we'll have your case, we'll listen to your case individually and make a decision on that. We do want people to know, some people may have the misperception that they can't see their PCM, and we actually very much want people to see their PCM, especially their primary care manager, especially if they have a chronic disease, diabetes, hypertension, COPD, all of these diseases that become comorbidities and put people at higher risk. We want to make sure that you're tuned up and that your disease state is in as low a disease state as possible, so that it puts you at a lower risk for actually having a bad outcome if you actually do get the disease. And again, you can message your care team directly and ask any questions. So we're going to do as many of these appointments in a virtual manner as we can. The first thing you do is you make contact. You may talk to a nurse, and they'll decide what you need and what your health care is, and together you'll decide if you need to talk to a primary care manager. If possible, your primary care manager is going to do your health care visit either over the phone. We're starting to get a lot of people ramped up on being able to do video, and in some cases we'll determine, hey, you need to come in and we need to have a face-to-face encounter. So those things are all working, and we do want you to keep your health up and keep healthy to give you the best chance if you actually get the COVID virus. Another big question on people's minds is the standards for testing, right? So we're talking about the COVID testing itself. And like I said last week, the testing time is greatly increased. When we first started doing this, the testing time was taking sometimes up to 12 days. And then it moved down into 8 days, and now, on average, we're at about 4 days, and we're getting better. We think eventually we'll have some pretty fast testing. I understand there's some outliers. There are a few people out there that still haven't gotten their test results. And there's a couple reasons for that. Number one, there's a few outliers that we haven't chased down yet. And we're getting with those labs and we're talking to them about individual tests and we're getting the results for you. And keep in mind, there's been over 540 tests that we've performed. So the more tests that we do, and as a nation, the more tests that we do, the slower the process is going to be. And we've done a fair amount of tests, and so has the rest of the nation. Our contracted provider told us they're doing over 30,000 tests for the entire nation a day. And another point I want to bring up, I said this last week, but I want to bring it up. We've had about a dozen people in the hospital that we thought exhibited COVID-like symptoms. Now they've all tested negative. But the point is, we've been going through those sets and reps. We've been taking care of sick patients. We've been doing all the precautions that we would with a COVID patient. So we're really getting pretty good at taking care of these folks and using all the proper precautions. But it also demonstrates that you can be sick, you can be really sick and not have the COVID virus. And as we mentioned before, there's a lot of folks that have the COVID virus that aren't really sick. So the testing in and of itself doesn't determine how you're treated. The way we determine that is a little bit different than it has been in the past. We used to have to go by a pretty strict algorithm. Now we're able to use a series of conditions that are based on a clinical judgment. You go to a physician or a nurse practitioner or a PA to get their clinical judgment, right? So it's the same thing now. And we want to conserve the testing for the sicker patients, people with high risk. Those are the folks with comorbidities that would make them sicker if they caught the disease, or maybe mission essential people that we want to determine whether or not they have the disease. Now the way that you get testing, if you need it, is you make a call to our nurse advice line or to that appointment line that we've given out in the past. And the hours for that are 6 a.m. to 9 p.m., including weekends. What we've seen is that there's a big drop-off of testing on the weekends, and then there's a big spike on Monday. And I just want to make sure that that's not people who don't understand that you can actually call and get that appointment and go get tested on the weekends. One reason that a lot of people, or not a lot of people, but several people, have not received their test results is because we've tried calling the number in their healthcare record and it's the wrong number. Or if we call it and they don't answer because it's an unlisted number, and then we can't leave a message to ask them to call us back. So on our end, we've started asking people as they come through and get those appointments to make sure that we have a good number, that we have an alternate number. If you could provide that, it would be very helpful. If you haven't heard from us in those 48 hours, not 2 days after you've gotten swabbed, then we would like for you to call us back. We want to make contact with you, okay? So if you haven't heard from us, go ahead and call us back and we'll let you know what's up. And then the last thing I want to talk about with regard to opening comments is the masks. For our medical team, we're going to be providing patient care. If someone has known COVID disease or that they're going to be doing a procedure that makes a lot of aerosolized particles, then they're going to be wearing that N95 mask that's very protective towards viral particles. Normally though, any time that you're doing a patient care encounter and it's not under those circumstances, your healthcare provider should be having a surgical mask on. And if they're not, it's okay to ask them. The patient doesn't necessarily have to have a mask on unless they're wearing their own that they brought from home, or they're showing symptoms of upper respiratory disease. We might ask them to put on a mask. And that's all I have for my opening comments. Thank you.
Thanks, Patrick. Just one more ad for our masks. If you want to donate masks, our MWR is capable of receiving those donations. You just need to call Andrea at 931-561-0021. So I thought I'd start the question and answer session with, there's a lot of commentary out there on expectation management. How long is this going to go on? Can non-mission essential people come back to work? When is training going to resume? And then lastly, more closely aligned to this week, is our mission essential folks going to get DONSs? So I'll throw that over to you first, sir.
Yeah. I'll start with the mission essential stuff. You know, again, if there is, we got a 4-day weekend coming up, Easter weekend, we're not directing any essential activity like I described earlier, maintenance or things of that nature, to occur over the weekend. and that should not have been the case last weekend as well, with the exception of supporting deploying activities. So in the case of last weekend, there was a lot of activity associated with pushing the 275 3rd Brigade soldiers out to the southwest border. That all unfolded at the end of last week, over the weekend, and they were in the air first thing Tuesday morning, I believe it was. So there are activities to support things like that that will involve some activity over the course of the weekend. But our routine readiness enhancing activities like physical training every day, again, the way we're doing that is generally individual or buddy teams, small elements, not a big formation at 6:30 as we would normally. It's spread out throughout the day. That's essential and will continue, but obviously not on the weekends. You know, the physical accountability of soldiers, is that essential? Yes. You know, we want soldiers to get face-to-face with their NCO about every other day or so. Also, units will have their medics look at soldiers periodically as well to make sure there's no change in their health, and make sure, you know, we just got accountability and take that opportunity to disseminate information and things like that. And then maintenance, is that essential? Absolutely. As I said, there's no change to some of our deployment timelines for a lot of our units, so their equipment, their aircraft have to be ready, and you know, we have to make sure that we have, you know, parts available. We put them on the aircraft. We got to test fly it. We got to make sure it's 100% good to go. So when the time comes to get it loaded up, it's set. So those things will continue, but again, for the most part, with the exception of the unique pistol range that we had to conduct for the southwest border. You know, we drove around the impact area today. There's no marksmanship ranges or things of that nature going on. There's certainly no maneuver training or collective training underway. The training is generally distance learning type of things. I saw a lot of great examples of what the units are doing, where they focus on weapons tasks one day and share a CR code that links to basic tasks of load, unload, reduce a stoppage on a machine gun, and 249 and their M4 and Mark 19 50 cal. So just good training that keeps the soldiers focused on that, so when we are able to resume traditional training, they're that much more prepared for it. So to answer the question, readiness essential, readiness activity will absolutely continue. It's our obligation and commitment to make sure that every soldier is trained and ready for combat. And while some of those things probably at the soldier level, I know, seem mundane, and there may be reason to question, is this truly essential right now? You know, perhaps you know, in the course of maintenance or preparing to turn in a vehicle, we got to lay out some equipment and things of that nature. It's required and it's essential, and you know, I trust that the units are making good, mature, you know, focused thought process as they go through the decisions on what type of activities that they do.
Excellent. Thanks, sir.
Sergeant Major, did you
yeah.
want to jump on that at all?
No, I think you captured it pretty well, sir, as far as it changes from really from day to day as we go through this, what's required across the installation and to accomplish our missions. But that'll be communicated through the leadership and the chain of command.
Yeah, and I'll say that from an installations perspective, you've got a lot of folks that can't take a whole DONZA weekend off. You have emergency services, police, fire department. We have our EOC that's tracking day to day our COVID response and actions. So the goal for those individuals that have to work is at least 2 days this weekend to be off.
Yep. You know, again, you think about our healthcare professionals in Blanchfield. You know, they're
Yes, sir.
working cyclic shifts, and they're all 100% essential, and they're throwing their shoulder into ensuring we're as prepared and as ready as we could be in the case that this grows. So
Yes, sir.
what may not intuitively or on the absolute surface seem like essential activity, I guarantee what they're doing is essential. If this thing grows to the point where we have to absorb COVID folks that we have to treat and really expand that capability in our hospital, the work now is going to pay off when and if that eventually comes. And I think everybody understands that.
Yeah, I think so,
Yeah.
sir. Yeah, great point. So I thought the next topic, this is from Amanda, and what she originally commented on were social gatherings. Are those still happening on the installation? But then others chimed in and talked to some of those things that you just talked about. Are we having formations? Is accountability really mission essential? PT, and what does that look like? And then the traffic coming on post, it doesn't look like we're reducing traffic all that much. So those are some of the comments out there. Maybe we can just talk a little bit about what good order and discipline looks like post-wide.
Yeah.
Yeah, I think it's important to you know, to really get down to what's essential. You know, with the states of Kentucky and Tennessee issuing a stay-at-home order, really we should be abiding by that too, unless you are one of those mission essential people that's coming to Fort Campbell to do work. You know, just because you're stuck in your barracks room bored or stuck at home off post, on post, and want to get out, and that's the wrong answer. It's not good for our community. It's not good for readiness. And so it's that personal responsibility you talked about up front is how we're gonna beat this. And we are doing that for the most part. We're doing a great job. But there are those folks out there that need to get hit by the train before they see it coming down the tracks, apparently. And those are the toughest ones to get through. But with the enforcement from the military police, a lot of the brigades have instituted courtesy patrols, are really cracking down on that across the formation. And also really our communities members reporting on their neighbors as well. You know, they're taking the steps to try and address it themselves, and if they can't, they're elevating it through escalation with the military police and reporting it to the garrison. I'd also like to talk about the hospital. You know, the hospitals are our front line of defense as we're fighting this, and what we can't afford is to lose any of our teammates that are working every day at the hospital to not only to prevent the spread of COVID, but also to just take care of our families, deliver babies, and those things that continue to happen in the hospital day to day. But they're also the most vulnerable. And so we've implemented these measures at the hospital for screening people before they come in, to see if they've traveled to any of the high-risk areas, to see if they have any of the signs or symptoms of COVID, not to prevent them from coming to the hospital, but to route them appropriately through the hospital to protect the people, our healthcare providers, as we go through this. And so I'd ask that everybody understands that you know, we're not denying care to anybody. We're just taking the measures to put them in a different place to protect our healthcare workers at the hospital. And that comes if somebody is deceptive with them and tries to go through get past them because they're fear of whatever. When it is discovered, they are going to be dealt with, and there are punitive actions that are taking place, and as well as administrative measures. So I'd ask for everybody's help in enforcing the compliance and the individual responsibility.
Great. I thought maybe I'd ask Patrick that same question. So maybe you can add a little bit more detail on what the CSM said and what you're seeing at the hospital, but more broadly, what steps has the hospital taken to protect the patients as well as the visitors that come onto or come into BOC? And then more specifically, folks still have questions about labor and delivery and what type of visitors you're allowing into the hospital.
Okay, great, thank you. First, thanks Command Sergeant Major Barker for nailing it. Really appreciate the message that you're reinforcing. And let me give a little bit of reason why. So as we've taken measures to protect our patients and our staff from people with the potential COVID virus or anything that's transmissible, we've taken our staff that are most vulnerable and we've assigned them to the roles of taking care of patients that have no symptoms, that have been cleared through our screening process. If someone is a little bit disingenuous and they get through our screening process and then they present to that provider and then say, oh, by the way, I have all of these symptoms, what they've done is they've completely skirted the system and they've brought disease to our most vulnerable providers, the very ones that we're trying to protect with this entire system. So what other things have we done to protect our patients and our visitors and our staff? It's a good point. So part of that leads into what you were talking about with regard to the visitors policy. So our visitors policy is that you should not bring a visitor with you to your healthcare appointment. If it's an outpatient appointment, you should come by yourself. If an appointment is for a child, obviously one parent can come, or if it's with somebody that needs a little bit of special help, a special needs person or an elderly person, then one person can come with them to help them. It's obviously the right thing to do, but anybody that doesn't need to be there should not come to the hospital, again, as we're preparing for and protecting from COVID-19 virus. With regard to our inpatient policy, and this includes the OB piece, we allow one visitor, but what I need to stress is that that one visitor should be the same visitor throughout the entirety of the hospital stay. For instance, if a mother is laboring on labor and delivery and a spouse comes to be with that person, we allow that one spouse to come and be of support. What doesn't make sense and what multiplies the amount of risk that we're giving to that patient and all the patients and our staff is if multiple visitors come. So if you have husband or spouse coming on the first visit and maybe mom or dad coming on the second visit, you've just tripled the amount of exposure to the hospital, to our staffs and patient. And that's why we're limiting to only one visitor. A lot of people are going to be inconvenienced, but it just makes sense and it's the right thing to do. Some of the other things that we've done with regard to protection for our patients and our staff and our entire community is we've separated the COVID treatment. So I've talked about this in the past, and I'll just reiterate it a little bit. We've moved all of the non-COVID treatment outside of the hospital, with the exception of surgical specialty care, and that comes in its own special doorway, so it's separated too. So COVID treatment comes in through the COVID clinic, and if you used to receive your treatment, outpatient treatment inside the building, we've moved all of those clinics. That's the Gold, that's the Aerosol clinic, that's the Young Eagle, you know, the pediatricians. We've moved all of the family care out to Byrd and all the soldier care out to either La Pointe or TMC5, depending. And so separation in time and space is one way that we can protect people. Obviously, the emergency department is open 24/7 as always. If you think that your illness is COVID related and you can wait, please don't go to the emergency department. Go to the COVID clinic in the hours that it's open, and that's you can make that call from 06 to 2100 at night. And if it's an emergency and it doesn't matter what it's related to, go to the emergency department immediately. Some other things that we've done is the Bach Pharmacy, the main pharmacy inside the hospital. Everybody can get their pharmaceuticals at the clinic where they receive the outpatient care, as I just described. So if you get your care at Byrd, you can pick up your pharmacy at Byrd. If you get your care at La Pointe, you can get your pharmacy at La Pointe. And then for pretty much everybody else, then you can go to the town center. Now, as a reminder, at the town center, we've instituted, in all the pharmacies, we've instituted a drop-off pickup policy. So you drop off your prescription, you come back at least 2 hours later, but usually it's ready for you right at 2 hours, and then you pick it up. And this is to decrease the amount of people that are in one space at a time. The physical therapy that used to be in Bach proper also has moved out to either Byrd or La Pointe. And patient records and patient admissions and dispositions have been moved. So patient records are out at the clinics where you receive care, and then patient admissions and dispositions, so if you're going to come into the hospital to have a baby, that's moved to the A entrance, which is our clean entrance where people are getting screened, and then the admissions and dispositions is on the left down the hallway there.
Great, thanks, Patrick. So we have a couple questions about PCSing. One, are orders that were published still valid? And then Fort Campbell is still receiving soldiers through CalSU. So a little bit of explanation as to why. So.
Right. So with the new soldiers coming in, what we were doing is we've got our first group coming in tomorrow from some medics coming in from Fort Sam Houston. What we did is chartered an aircraft, and it's going to take soldiers that are coming out of AIT at Fort Sam Houston. They're going to drop off a group of them here, and then they're going to go into Fort Bragg and drop off another group of soldiers. And so what we're doing is we're taking soldiers from a clean spot all the way to another clean spot with no cross-contamination. That's how we're able to do that. Unfortunately, with our families that are and soldiers that are PCSing or stuck in limbo in that PCS mode, we don't have those guarantees to protect them. And so we're still working through that right now. And I would encourage those soldiers to get with their chain of command and work through how we can get them compensated to ease the burdens that they're going through right now, whether it be material through the ACS loan closet, AER grants or loans, or maximizing the entitlements that they're entitled for whether it's TLE or per diem for what they're going through at this time. Each one will be dealt with uniquely
Yeah.
because they're all unique cases.
And IHG has said that they'll use the BAH rate to calculate daily
Right.
stays in the
I think one of our focus topics next week will be the G1 will craft
Yes.
something that summarizes the additional things the Army is applying to folks that are caught in a pretty tough situation.
Yes, sir.
You know, again, what probably the most challenging are, and we have, you know, I think it's close to 40 folks that are in a situation where may have sold their house already or moved out of the house they were renting. Their household goods have shipped to their next duty location, and they were in temporary lodging awaiting final out before the stop move was imposed. And again, we'll kind of really capture in detail what the additional options are, one of which is the IHG, you know, offering the rooms for what the BAH rate would be during that time. So the entitlement the soldier and their family gets for housing is applied toward that. But again, we know there's people that bought homes that are already paying the mortgage on a home that they're hoping to move to, and we'll lay out exactly these developing additional entitlement options that we'll summarize next week.
Yeah, great. I think for next week, we'll hit a lot of those topics that are more individual issues that families have to deal with, but very important to our audience. So thank you for that, sir. We talked earlier about the CDC classifying New York, New Jersey, Connecticut as high-risk areas, and that presents challenges for all over the nation. But what are some of those challenges that we are going to face as a community here at Fort Campbell?
Well, yeah, so one thing that's being implemented now, and we talked about folks coming in, those medics, it's a unique circumstance. You know, they're in as Sergeant Major described, in a clean spot, in a clean aircraft to a clean spot. We'll get them integrated in their units as quickly as we can. But anybody that's coming here that may have been on a long duration leave before this started, or may have already moved from their last duty station and are taking leave en route and are soon to report, will have to undergo a 14-day quarantine on arrival. Until very recently, today in fact, that was only the hot spots or out of CONUS overseas. Now it's any travel. And back to Colonel Birchfield's comments, you know, for our cases that we do have, we have a team that really forensically traces back how the individual got in contact with COVID-19 and likely how they you know, got it and how they brought it back to Fort Campbell. And almost all, and a couple we're still finishing the investigations on the late breaking ones, are travel away from Fort Campbell in multiple areas, and they brought it back here and may have spread it to, in one or two cases, roommates, co-workers, etc. So it's been a travel related away from Fort Campbell outside that 50-mile area. In one case in Northeast United States where there's a lot more cases, and brought it back here. So that is why we are being very rigid on a lot of things. The travel restriction to 50 miles, the social distancing, the minimum essential manning, but still essential readiness activities happen, but with good, prudent measures applied when we do that. And then all the things that probably are frustrating some folks at the hospital, like the limited entrances, the postponement of some services. I know in the case of you know, birth of a child, love to have you know, multiple family members there, but we just can't do it. We cannot put our BOC workforce at risk, because as this thing grows, which we know it will, we have to be absolutely ready with our physical facilities and our team of teams over there at Blanchfield and across the medical community of Fort Campbell to be ready to mass on this as it grows, so it doesn't grow you know, beyond our ability to maintain position of advantage over it. So kind of look at it like how we'd attack an enemy fortified position. I mean, we got to be absolutely ready.
A defensive in-depth, if you will. Yeah, and you hit a good point, and it's the theme that we keep on coming back to, and that's social responsibility. You're going to make decisions that are best for you and your family, but now we're asking you to make decisions that are best for the community.
Yep.
And if that means staying home and self-identifying as I need to quarantine, then let's do that, for sure. So there were questions previous leading up to the town hall about what's the quality of life for our soldiers that are in quarantine. So I'll take that on right now. It's kind of a good time in this forum to do so. So early on, we set up these sites. They're both quarantine and isolation sites on the installation. They're in older barracks that are for permanent party here on Fort Campbell. Generally, our soldiers live fairly well. They're provided 3 meals a day. We have gotten them Wi-Fi capability through MWR and PUCs, but we're also looking at medium-term and long-term fixes for these buildings for Wi-Fi. They can receive outside deliveries of food, so they're not locked in a prison. They can do physical fitness. They're provided gym equipment in a box, kettlebells, plates, bars, etc. And then MWR has also provided, as well as unit provided, entertainment for our soldiers, and that's video games, television, etc. We also have counseling services available because this is a stressful time for everybody. The chaplains routinely go in, as well as our medical professionals routinely check on those in quarantine and isolation. CSM, do you have anything else to add?
Well, I'd like to add on top of that, not just for our folks that are in isolation and quarantine, but really for the greater Fort Campbell community. With, you know, we've shut down just about all the MWR and recreation things, and so it is tough for our families and our soldiers as we're going through this. But I want to remind everybody that our Ready Resilient Center is still open for business, even though it's in a more distributed manner. They have arts and crafts that kids can pick up, that drive-through that they've done. There's daily physical training videos that they're putting out that can help towards ACFT or whatever your fitness goals are. Performance enhancement, Army schools prep, and a lot of other activities that are available out there. That's available to everybody here on Fort Campbell.
Excellent. Yeah, some tremendous resources out there for our soldiers as they kind of deal with the hardships of a coronavirus crisis. You mentioned one. The resiliency folks are tremendous. They have daily posts that they put out there for our families and for our soldiers, just to keep their minds active and their bodies active. We also have MFLICs. Those are the military family life counselors. Tremendous asset, and they can still do counseling. Just need to go through your unit, and they'll help coordinate that. Anything else for soldier support and service?
Yeah, so you know, as I'm kind of scanning the comments here as we go, there's a lot of questions about APFT, ACFT, availability of workout equipment. A lot of folks want the gyms to open. That was a tough decision that we made. We put a lot of effort to mitigate things, but it got to the point where, again, back to how this thing's transmitted, it's generally through droplets, you know, microscopic droplets, and that's the whole thing behind the masks. And there's a lot of comments about the masks too. Don't you know these aren't going to be effective, etc. The purpose of the mask, as Sergeant Major Barker said, is to prevent the mask wearer from, you know, expelling microscopic droplets, spit, etc. To keep that contained so it doesn't get on surfaces that are touched by somebody else, and that's how the virus is transmitted, not airborne virus. You know, the APFT and ACFT, I'll ask Sergeant Major to talk about that. There has been an Army decision on postponing the formal implementation of the ACFT, and he'll talk that. Basically, your last record APFT is your record APFT until further notice. And then with regard to the gyms, you mentioned what we arrayed at the quarantine facility. Units have gyms in the box, and you know, a lot of units have great plans where they have that accessible throughout the day. So for a company battery or troop size organization, ideally over the course of a week, they're staggering the days that soldiers need to come in for physical accountability, and when they do convene for PT, there's times, predictable times, when they know that the gym in the box stuff will be available and open. But again, you got to exercise some pretty rigorous disinfecting, etc. So as you you know, execute whatever it is you're doing, you're disinfecting and wiping off the kettlebells, the plates, the bars, the bench cushions, and all of that which comes into contact with you. But you still have the equipment to use and get a good workout. Sergeant Major, do you want to talk more about the APFT, ACFT, and how it relates to promotion points?
Yes, sir. I think he
all that?
captured everything has really been suspended. It's still, you know, for your promotions, it's still your last record APFT is what's being applied towards that at this time, and that's going to be for the foreseeable future until we get things under control, and kind of get back to a new normal and able to conduct some of those activities again.
Yep. But it's coming, so continue to prep for it. And prepping for the ACFT is just good PT. So
It's a good
Yeah.
opportunity to do it. We have nothing to do but PT and make ourselves better as soldiers. Deployments are on people's minds. Folks returning back, are we going to extend folks that are currently deployed? But I'd like to take, obviously, that's a good topic, but also add in there Red Cross messages and how that's so important and a critical step in dealing with emergencies.
yeah. So the deployments, our next major deployment, and again, I expect we're going to have some relatively short notice deployments that we'll execute in the days, weeks ahead, and again, most likely in the next immediate 2 to 3 weeks or so, but potentially much sooner, would be elements of the Sustainment Brigade Lifeliners for that logistic support for these pretty phenomenal efforts up in New York and likely some other major metro areas as we go forward. The next planned deployment was a rotation of the task force in Africa, which was delayed. So that's a relatively small number of about 250 3rd Brigade troops, and we will execute that as soon as we can. Now that was a planned 6-month rotation, so they'll likely stay closer towards the standard 9-month rotation before we're able to rotate them. Our next planned rotation after that then is the big move with the CAB. That's us deploying when we make the determination based on the conditions and how long this COVID thing is, you know, our absolute focus. We'll go from there. So right now it's still the June, July, early July timeline. And some things happen to have to happen before that. But if this pushes it to the right, you know, we'll make, again, good informed decisions and shift it accordingly.
Excellent. CSM, anything on Red Cross messages that you wanted to highlight?
Yes, as we've had to elevate the levels of approval for these things, it's absolutely imperative that we get those through sooner, so that we can process those things, and you know, and then also with with the travel, those soldiers are going to incur a quarantine on the back end when they do return. So that's something to be cautious of as well.
Great. I thought we're kind of running short on time, so I thought I'd throw this over to Patrick real quick. CG mentioned that we're moving, or we're making preparations if this virus does become more challenging in the coming weeks and becomes a major outbreak locally. What is the hospital doing to prepare?
Hey, thanks for asking, Jeremy. Let me tell you, Fort Campbell and the Fort Campbell community, the surrounding communities, need to be very, very proud of BOC and what we've done. One of the things that we've done was we've created the first ever future operations cell at BOC, and believe me, I had to rob a lot of departments of their department chiefs and helpers, but it was effort that was well worth it. So what they've done is they've created a plan that allows us to expand as necessary based on the medical requirements of our Fort Campbell community. So if we see an expanded need or an expanded requirement to take care of patients, we can expand our capability. And in so doing, we've made a plan for the floor plan, for the actual space. We've made a plan for how we're going to use equipment and where we're going to put it. We've made a plan for how we're going to train people and sharpen those skills and kind of re-blue them to do things that they haven't done for a while. Maybe take physicians, providers that haven't done inpatient medicine and reteach them some of those lost skills, and take people that are used to working in different scopes of practice and get them used to doing inpatient medicine on the wards. And in general, everybody has found it rewarding. They've found a lot of value in it. It's been a great training for them. It's been a good opportunity to get re-blued. It's been a great opportunity for the organization to create a pandemic plan, the likes of which has never been seen before at Fort Campbell. And I'm just very, very proud of our team and the things that they've done to prepare so that we can take care of this community if the need arises.
Thanks, Patrick.
Yeah, I'll pile on.
Go ahead, sir.
The Bach team and our medical professionals across Fort Campbell are absolutely ready for this thing to get bigger, which we expect, and again to counterattack it when it shows itself in more strength here. But the effort thus far has been phenomenal. The preparations they've done and the contingencies that they've thought through and developed should really have one rest assured that you know, if you get this thing and it requires medical care, you got the best possible team around to take care of you.
Awesome. So we're coming up on the last 5 minutes. So what I'd like to do is kind of end where I started, and that's by reinforcing our theme, and that is we protect ourselves as soldiers, as units for the Army by making sure that our community is well informed and that we all make good decisions. So I would absolutely encourage everybody, make good decisions, make responsible decisions, make decisions that are responsible for the community, not just yourselves. I will also say that this is a religious week for some, and our chaplains are doing services still, so they're doing virtual services. And if you are interested, they are live streaming their chapel services. You can go to Facebook at 101st and Fort Campbell Chaplain's Office, and you'll be able to get both the times as well as the posts that are out there. So, sir, I'll conclude there and maybe go over to CSM first.
Yeah, there's also been you know, a lot of questions about grooming standards and haircuts. We still have the barber shops open on the installation, despite the ones in Kentucky and Tennessee, beauty shops, all those being closed down. And you're looking at 3 of the busiest men on this post, and you know, you have a couple options. You can go to the barber shop like Colonel Bell did today, or General Winsky does, or you can give yourself the COVID-19 special and maintain the standard.
Well done, CSM.
Well, yeah, you know, in closing, Fort Campbell's a great team, and I've served here a lot of years over the decades, and Fort Campbell, like no other place, comes together as a community and enmeshed with the communities around us during tough circumstances, and we're on the cusp of tough circumstances, but we will absolutely take care of ourselves and our families, our soldiers, through and get through this thing, and we're relying on you to do your part in terms of everything that we need to do to defeat this thing, and we'll emerge from this thing stronger and better for it. And again, Command Sergeant Major Barker and I remain committed to ensuring that every decision that's made is informed and has the advice and the inclusion of our medical professionals, our emergency services professionals, our surgeon, our hospital commander, his staff, our infectious disease specialist. We absolutely integrate them into every significant decision that's made, and again, that is a team of incredible professionals that enjoy our complete trust and confidence. So thanks so much for the opportunity to spend some time with you again this evening. We'll do it again next Tuesday night, and you know, barring any significant change, we'll keep going on about a weekly basis, this time Tuesday nights at 1800 Central. Thanks.
Thanks, sir.